Hey guys, and welcome back to my channel. If you are new to my channel, welcome. If you guys been following me on my journey, you guys know I am in the process of trying to take my boards. It's just taking forever, but in the meantime, we're gonna just keep rolling with these videos. You guys asked me to record a video talking about Med Surg, how I studied for it, and I just recently shared a story about Med Surg pertaining to my last quarter. So if you guys want to check out that video, I will definitely leave a link below. So Med Surg combines pharmacology, A&P, and also fundamentals or foundations, whatever you want to call it. And it also incorporates clinicals in the mix. So everything that you're learning, you're basically applying to clinicals. So that's why it's called Med Surg Clinicals. And in my LPN program, Med Surg was actually broken down into two components. So we had Med Surg 1 and we also had Med Surg 2. So the only difference with Med Surg 1 and 2 is just that we learned different disease processes at different times. So Med Surg 1, we learned about oncology, we learned about hematology, we also learned about the renal system, musculoskeletal system. Med Surg 2, we learned about neuro, endocrine, what else? Immune system and dermatology. So with that said, you would definitely learn about this all in A&P, but with Med Surg, you learn a little bit more. It's a little more detailed. Obviously, with the nursing interventions, you also learn about the drugs, which you have learned in pharmacology, but again, in Med Surg, it just gets a little deeper. And when you're in clinicals, you actually see a little bit more. So how I studied for Med Surg, I just want to advise you guys, this is a little tip, you don't have to do this, but get yourself a sketch pad if you want to make your concept maps, and definitely get a planner. You need this throughout nursing school to begin with, but having a planner is crucial while you're studying for Med Surg. And get yourself some highlighters, some colored pens or colored pencils. Definitely helps with you making your concept maps and your notes. But studying in color for Med Surg, it will make your life a whole lot easier. I know me, I'm an auditory learner, but I'm also a visual learner. So the more that I draw things out and, if I color code everything, it will just stick that way. Now, I say get a planner because honestly, with Med Surg, it's just really overwhelming. It's a lot of information and the chapters tend to be really, really long. So I would definitely plan ahead my studying time. Now, while I was in nursing school, LPN program specifically, we would have a test literally every single week. So the day that we would have our test, we finish our exam, we're on to the next chapter. Alright guys, so I'm going to show you all how I prepared myself for my Med Surg lectures. So say we had a week ahead of time before we got into the lesson, I would try and read or at least skim through the chapter ahead of time. Maybe like 20 minutes a day I would devote to reading the chapter because these chapters are really long. I mean, this chapter in particular is not as long as others, but it's considerably long and you just want to give yourself time to like read the information and try to retain it. So as you guys can see here, I underline information. This is what I would do while I'm skimming through the information, and then I would put subtitles just basically summarizing what I just read. And let me tell you guys, time is of the essence while you're in nursing school, and even doing little things like this, like tagging your textbook, it just helps you navigate through it a lot better. And also, as you guys can see, I have highlighted information, that way it stands out. Again, I have a subtitle here just to show that I'm looking at lab values. I'm going to show you guys a little trick as well when it comes to my concept mapping. So as I'm reading through the text, if I find that there's something that I need to create a concept map for, I would just put concept map as an indicator that I need to create it. And what these little things mean, that's client teaching and nursing interventions. So that way I know exactly what I'm looking at, where to plug it in on my concept map. And as I get towards the end of the chapter, you have questions here, and I just want to encourage you guys to do the questions in your textbook. Now, another thing that I would do prior to class, I would download my notes, and we had the luxury of having access to our PowerPoint slides ahead of time. Now, having access to these slides ahead of time, it just made life a little bit easier. That way I just get familiar with the material. So I'm going to show you guys what my PowerPoints would look like. Ooh. So this is what my PowerPoints would look like, I would try and print at least 6 boxes a page. Obviously, if there's a lot of information, I would want to give myself space, so you could probably print out 3 boxes a page, whatever is to your liking. Now, let's say you don't have access to the slides, or your professor is just one of those that doesn't want to share the information prior to class. Like I said, just make sure you skim through the textbook, you make notes for yourself. If you have any questions, you highlight, or if anything, you can make your own PowerPoint, so that when you come to class and you could just kind of jot everything in. Now, I actually used to type up my notes while I was in class, but I found like it was really time consuming. And for me, I just feel like while you're in class, you should be listening. You really shouldn't be taking notes like that. And that's why I'm saying it's really important that you take advantage if your professor is providing the notes, so that way you can just focus on the lecture in itself. Now, after class, what I would do is I would go home and I would reprint my slides, and all the information that I have here, which is technically like my draft, I would rewrite everything onto a new PowerPoint or new slides, new notes. That way it just looks a lot neater, because I'm not focusing on making it pretty while I'm in class. I'm too busy listening to the lecture, as you should be. So stuff is gonna look like a hot mess, obviously, while you're in class. But when you get home, you can make it all pretty. Now, I made a video, I don't know, it was the last month, and I showed you guys how I took my information from my old PowerPoint slides to my new PowerPoint slides, my old notes to my new notes, and that was just a method of note-taking and reinforcement. It kind of just sticks better. The more I write things over and over, it kind of sticks. Now on to concept mapping. I want to stress to you all before I continue, when you're doing a concept map, keep in mind that these 4 things are mainly going to be on your exams. So signs and symptoms, lab values, so knowing your normal ranges, nursing interventions, and client teaching. These are the main concepts that you definitely need to know for your exams. Very rarely are you tested on the patho of things or the risk factors. Sometimes you are quizzed on the drugs, but when it comes to Med Surg, it kind of just ties everything together, and it's more critical thinking. So definitely keep that in mind while you're making your concept map. I'm going to break down what this concept mapping is all about. Now, my concept maps actually don't look like this. I usually draw mine out, and if you guys been following me and watching my videos, I shared how I did my concept maps in the past. So I'm going to break everything down for you short and sweet, so that way you guys know what to do, where to plug the information, where to get the information from. So pathophysiology, this is basically what is going on with the body that is abnormal. So you're basically going to summarize what is going wrong with the body. What is this abnormality? Now, with risk factors, these are any characteristics or attributes that expose the individual to a certain disorder or disease. So this can maybe be their sex, maybe they have high blood pressure, maybe they're a smoker, maybe they drink alcohol, so that exposes them to this injury. Signs and symptoms. Now, signs, this is something objective. This is something that we would see as a nurse. Maybe the patient is bleeding from their nose. With the symptoms, this is something that the patient feels. So anything that they perceive, maybe they have back pain, maybe they're experiencing anxiety. So this is just evidence of what is going on there. With the labs, these could be vital signs, underlying conditions. So you're going to look for lab values, BUN, stuff like that. Med management, obviously this is medications given to the patient, so you kind of just break everything down. This would also be a part of your nursing interventions, and these are activities in which you perform as part of the care process. So any treatments that you need to give for the patient, you're going to put nursing interventions, and obviously this kind of ties into med management. Now, complications, this may be anything that is common with the disorder, or maybe they had surgery, so anything post-op will be common, like fever, DVT, urinary retention. It depends on the disorder that you have here. So if there's anything that is wrong or there's toxicity going on, those are complications that you would run into. You would put them here. Client teaching, which is pretty straightforward. This is what you do on a daily basis. Your role as a nurse, so you're going to be teaching them prevention. This is prior to discharge. If they're on any medications, you're going to tell them what to do and not do, avoid driving, avoid alcohol, and you're basically teaching them how to manage their condition overall. I also want to address with these concept maps, if you have an ATI book, like this one, it literally breaks everything down for you. I'm telling you, this was my treasure in Med Surg, and I wish I used it from the beginning, but I didn't. But it literally breaks everything down. Now, I'm not saying you shouldn't read the textbook at all, but let's say you are like in a hurry, because all through nursing school, time management can get a little out of whack. Everybody is not perfect. Trust me, I had some times where I was studying the night before. But if you are on a time constraint, I'm telling you guys, this book, if you guys use ATI, use your Med Surg ATI book. Alright, so let's say you're having trouble understanding a certain disease process or topic. It's not clicking while you're in clinical, or maybe you're not even getting a chance to be exposed to that, so you're not understanding what it looks like in person. Your professor is not the best at explaining things or to your liking. You can definitely be your own teacher. Just make sure you do your research, guys. Go on Google, pick up books, go on YouTube, look at videos. There are tons of channels out there. I know everybody roots for Registered RN. She is great, but there are other channels as well, and I will definitely leave links below so you guys can check out those channels. And also, I want to suggest to you guys, use Quizlet. I use Quizlet all throughout nursing school. You can make your own flashcards, and you can also listen to them. And I feel like that's kind of the great thing about it, because while I'm driving, I'm listening to my flashcards, or wherever I'm at, I'm listening to my flashcards. I don't have to carry a whole bunch of flashcards around. They're on the computer. You can use them on a computer, on your phone, your iPad, whatever. It just makes life a little bit easier. And guys, I advise that you all buy yourselves an NCLEX preparation book. Not only will you be preparing yourself for the NCLEX, but you'll be preparing yourself for the Med Surg exams. And I'm telling you guys, there's a lot of critical thinking with these Med Surg exams. So you just want to get yourself accustomed to answering the questions. And I know that the way this book is set up, it has the rationales right next to the question. So what I would do is I would take a piece of paper or a pamphlet and just cover everything as I go through the questions, because again, you just want to build up that confidence. You don't want to have that instant gratification of knowing what is the correct answer. And guys, as I mentioned, you want to make sure that you pick and stick. If you go through the question, you see the answer, you know that's the answer in your heart, leave it alone. Don't come back to it. Don't change it. I was notorious for doing that in Med Surg, and that's how I started messing up on my exams. So definitely take heed. But yeah, guys, that's pretty much it for this video. I'm sorry that I had to cut it short. As you guys know, I have a lot going on in my background. That's been my struggle with these videos. If you guys have any questions, definitely leave a comment below. Just takes me some time to get back to you guys, because sometimes I'm just not by my phone. I'm not reading it. But yeah, I appreciate you guys for subscribing. And yeah, check me out in my next video. Now, guys, I'm going to add a little bonus. This is a YouTube channel that I follow. I also follow her on Instagram, but this is TootRN, and she shares different questions, NCLEX style questions specifically, and you guys will definitely benefit from this. So if you guys want to follow her channel, I'll leave a link below in my description box. But yeah, I'll leave this question with you guys.
We know that we're being asked, what do we want to immediately tell our provider about? Which one of these things, which one of these options do we have to report right away? Now, what do we got here? We know that the client has acute pericarditis. We're assessing them. So thinking about acute pericarditis, this is where we want to apply our knowledge, right? So we got to think, well, what is it? What is acute pericarditis? We know that's inflammation of the pericardial lining, right? That's the lining that surrounds the heart. So it's inflammation of that lining. So we should be thinking about that and all the outcomes, right? All the outcomes of what happens when you have inflammation of that pericardial lining, that pericardial sac. So looking at these answer options, we're looking for what we immediately want to report. And that term should really jump out to us, right? Immediately. We know that means priority. Above everything and anything that we have the option to do here, A, B, C, and D, which one is the right now, gotta get on it.